Bismillahirrahmanirrahim. Welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. Today in this video lecture we are going to see Rouleaux formation and we are also going to see basophilic stippling. In the previous videos lecture we talked about band cell, nucleated RBC, and we are also talked about the blast cells. Before that videos lecture we also talked about blood smear. We talked what is blood smear. We talked anisocytosis, poikilocytosis, and variation in RBC, hypochromia, hypochromic. All these things we already talked about. So this is actually also the video lecture that is regarded to the blood smear. Okay, if you missed the previous videos lecture that is regarded to the blood smear, it will be present into my channel. The link will be also present into the description box, then you will check out it. So today in this video we are going to see the Rouleaux formation. As you can see in the these are the microscopic field, and the microscopic field of the blood smear, this is the Rouleaux cells. When the blood cells RBC are in a chain form, okay, this is called Rouleaux. And when it is in a not in a chain form, and when it is connected to each other just like in this form, we call it agglutination. This is agglutination, this is the Rouleaux formation. This is the real picture of the microscopic slide when you make the smear, and when you see the Rouleaux cells, these are the Rouleaux formation, then this is called Rouleaux formation. And in which condition these cells will be present? So it will be present in case of the chronic inflammatory disease like rheumatoid arthritis, systemic lupus, erythematitis, or inflammatory bowel disease. It will be present in case of the plasma cell disorder, like we can say multiple myeloma, that can lead to increased level of immunoglobulins into the blood. It will be present in case of certain infections, paraproteinemia, dehydration. So in this condition the Rouleaux will be present. Then we have basophilic stippling. Now what is basophilic stippling? Remember, basophilic stippling means the basophilic like granules. So we better know that the basophil cells will be present in a very low number, or like we can say in a cell it will be in whole cell it will be we can say that 1% it will be present, or 0% we can say, and their number will be increased in case of cancer. One thing more, that when the basophilic granules, so now this is the basophilic cells, they have granules. As you can see, the small circular are actually the granules inside it. So when the basophilic granules are present within the RBC, now this is the RBC cell and they have the basophilic granules, as you can see. So remember, when the basophilic granules are present within the RBC, we call that RBC basophilic stippling. And these basophilic stippling will be present in case of lead poisoning disease, thalassemia, myelodysplastia syndrome, exposure when a person is exposed to certain types of the toxic drugs such as arsenic, ethanol, or some chemotherapeutic agents, and due to the hemolytic anemia. So due to this way we can say that the person should have basophilic stippling. So this is about the basophilic stippling and Rouleaux formation. I hope this video is helpful for you. Thank you so much for watching.